Hi, everyone. Dr. Patrick McGrath from NOCD. Happy to be here with all of you, doing some of our fun educational chats with you. And one of the questions that has come in that people are interested in talking about is how is OCD potentially different in men versus women? And that's a great question because here's the interesting thing about OCD. There's not a lot of differentiation, unlike many other mental health conditions where we'll see that men or women will have a higher level of it. Now, that being said, there's a lot of research to still be done about transgender and how that comes into this. So please stay tuned for more research in that area. What we have right now that I can speak to is best in terms of men versus women. I just wanted to say that to be sure that we are culturally wanting to really figure that out. It's an interesting condition that it seems to be equal among men and women. And that, again, is kind of rare in the mental health areas. Now, in terms of presentation, there could be some differences. Number one, it is not uncommon for women to report cyclical changes throughout the month as their cycle goes on, or their period happens. This is pretty common. We can also see in perinatal OCD, where once somebody becomes pregnant, hormonal changes can play a role in OCD. But it's not just that, because it could also be the fact that becoming pregnant is a stressor, and that stressor is enough to kick off OCD. If we think of OCD in terms of what we call a diathesis stress model, or I have a genetic predisposition towards certain things, but I need the right stressor to kick it off, having a baby or even becoming pregnant could be the stressor that really kicks something off. Now, this can happen in men too, because again, having a child is a stressor, and that stressor could happen to men. So perinatal or postpartum OCD is not limited to the parent giving the birth. It is actually something that could happen to the partner. It could even happen to people adopting children. It could even happen to people who foster children. There is a role potentially of hormonal concerns coming in here, but it's not a 100% guarantee that that is what is going to be the difference. Other ways that we might see it could be around stereotyped kind of gender roles that could happen. For people who may have a sexual orientation-based OCD, if they seem to have interests that might align with an opposite orientation, well, that could be a cue for OCD to say, hey, wait a minute, that's not typical. Maybe that means something. It doesn't, of course, have to mean anything, but OCD will grab onto it anyway because, well, frankly, that's just what OCD does, right? It likes to take a tiny little minute thing and blow it so out of proportion that it's absolutely ridiculous. So that could play a role in the whole experience. Finally, you may notice that there could be some differences in when OCD occurs. We do see that boys seem to develop OCD earlier than girls, but by the time of puberty, it does seem to kind of even out and stick that way through the rest of time. So the gender differences in OCD, I think, are minor compared to what you would see in a lot of other mental health conditions. That isn't to say, though, that they don't exist, and it isn't to say that they wouldn't be a part of treatment. But OCD really is an equal opportunity pain in the butt to anybody, no matter who they are, what they are, and it will go after the things that you enjoy and love and think are important and get you to have doubts and questions about them. So, gee, thanks, OCD. How kind of you to be so wonderfully welcoming to everybody. We wish you would be welcome to no one and that you would just go away. And that is what we will continue to work toward here at NOCD to make sure that you don't ruin the lives of anybody else anymore. Always remember this. If you're looking for help for OCD or related conditions, check us out at nocd.com. That's NOCD.com, where we have therapists trained and willing to work with you. They are in all 50 states. We also work in Canada, the UK, and Australia. We work with body-focused repetitive behaviors, hoarding, tics, OCD, of course, and even things like mood issues, trauma, and other anxiety disorders. Help is available. Please reach out. We're ready to assist.